Whether you are a outpatient coder or inpatient coder, if you want to master digestive system coding, must watch this video. In this video, we are going to discuss most common digestive system procedures where we will use ICD-10 PCS as well as CPT codes. After watching this session, if you feel this video is helpful for you, please click on like button. If you want to master, watch this video until the end. So, we will learn procedure based on top to bottom approach in the digestive system. As all of us know, GI tract divides into two parts, upper GI tract as well as lower GI tract. First, we will learn procedures related to upper GI tract, then we will learn procedures related to lower GI tract. Also, we will learn few additional structures like gallbladder, pancreas, and few other procedures. First, we will learn esophagus procedures. So, esophageal manometry, a test measuring the pressure and movement of the esophagus muscles to assess swallowing disorders. Okay, so wherever you see esophageal manometry, basically patient will perform this esophageal manometry in order to measure the muscle in the esophagus. So next one is Bravo pH monitoring. So placement of small capsule in the esophagus to record acid levels over time, helping diagnosis acid reflux. So most of the time patient will perform this Bravo pH monitoring for acid reflux disease. Okay, so in the operative report, if you find Bravo pH, your PDX must be acid reflux. So during the procedure, patient will insert the small capsule in the esophagus. Next, esophageal dilation. So this is very simple. If the esophagus is narrowed, patient will use balloons or bogies to dilate the esophagus. So which will provide difficulty relief from the swallowing. Next, we have esophageal lengthening procedures. Okay. So surgical technique to increase the length of the esophagus, often performed for severe reflux or hiatal hernia. So whenever you want to code this procedure, we need to check the medical necessity, must and should. For example, if you want to code esophageal dilation, so your PDX must be narrowed or stenosed esophagus. Next one, laparoscopic esophageal sphincter augmentation. Okay, so minimally invasive procedure, implanting a device to strengthen the lower esophageal sphincter, reducing acid reflux. So all these procedures mostly related to esophagus are for reducing acid reflux. Usually we will call it as GERD. Okay. So next one, esophagomyotomy. So surgical cutting of the esophageal muscle to treat achalasia, a condition causing difficulty in swallowing. So if the patient is having any type of difficulty in swallowing, patient will perform esophagomyotomy. So basically myotomy means incision on the muscle. So esophago means esophageal muscles. So in order to treat achalasia. Okay. Nissen fundoplication, wrapping the upper part of the stomach around the lower esophagus to prevent acid reflux. Again, acid reflux procedures is the Nissen fundoplication. So, if anyone looking for medical coding jobs in UAE, USA and India, join in our WhatsApp group. Group link is in the description of this video. So, our trainings will be CMNet surgery training, IPDRG, SEC and CCS certification training. If anyone is interested to undergo these trainings, please send WhatsApp message to 707-526-3939. So next one is transendoscopic balloon dilation. So transendoscopic means through the endoscope, patient will insert the balloon and he will dilate the esophagus. Okay. So using a balloon during endoscopy to expand narrowed areas in the esophagus or stomach. Next, papillotomy. Most of the time you will see this papillotomy word in the ERCP. Okay. So endoscopic retrograde cholangiopancreatography. Incision into the duodenal papilla to access and treat biliary pancreatic duct issues. So if the patient create incision on the duodenal papilla, we will call it as papillotomy. So mostly you will see in the ERCP procedures. Next, sphincterotomy. So this sphincter is exists in all type of openings. So for example, if you take esophagus, we have esophageal sphincter. For example, if you take anus, we have anal sphincter. Okay, so what is sphincterotomy? Cutting up a sphincter muscle to relieve blockage or retention. So as we discussed, these sphincters in presence in esophagus, biliary tree as well as anal canal. Okay. Next, we will see procedures related to stomach. Okay. So gastroscopy. So what is gastroscopy? Endoscopic examination of the esophagus, stomach and duodenum to diagnose or treat conditions. So patient will perform this gastroscopy for so diagnostic as well as treatment of conditions. Okay, so usually you will call it as EGD, esophagogastroduodenoscopy, where this gastroscopy includes all three areas of the small intestine or upper GI tract like esophagus, stomach and duodenum. Next, gastric balloon placement. So insertion of a balloon into the stomach to limit food intake for weight loss purpose is called as gastric balloon placement. So in the live coding, you will see codes for all these procedures. So if you want to know the procedures too along with these definitions, please mention in the comment section. Next, gastrojejunostomy. So wherever you see stomy, we need to understand that it is a artificial opening. So surgical creation of a connection between stomach and the jejunum often to bypass a blocked area is called as gastrojejunostomy. Okay, so opening between gastro means stomach and jejunum. So in order to prevent the blocked area, patient will perform gastrojejunostomy. Next, pyloroplasty. Surgical widening the pyloric wall to facilitate stomach emptying. So stomach contains pyloric wall. If the patient performs surgical widening this pyloric wall, we will call it as pyloroplasty. Gastroplasty. Surgical reshaping of the stomach to aid in weight loss is called as gastroplasty. Okay, so basically repair of the stomach is called as gastroplasty. Most of the time patient will perform this gastroplasty for weight loss. Dilation of gastric duodenal stricture. So this is self-explanatory. Basically, if the patient is having any type of stenosis or narrowed area in the stomach or duodenum, patient will perform this dilation of gastric or duodenal structure in order to improve the passage of fluid or food. Submucosal injection. Injection of fluid beneath the mucosa during endoscopy to lift lesion for safer removal. In medical coding, mostly you will see this procedure in the EMR procedures. Okay, so usually we will call it as endoscopic mucosal resection. For that time, in order to lift the mucosa, patient will inject this injection. Okay, usually you will see it as blue boost. Next, we will see small intestinal procedures. So enteroscopy. So here entero means intestine. Scopy means examination. So endoscopic examination of the small intestine beyond the stomach to identify bleeding or lesion is called as enteroscopy. Okay. Capsule endoscopy. Swallowing a small chimera capsule that captures images of the small intestine to detect abnormalities is called as capsule endoscopy. Pancreaticojejunostomy. So surgical connection between pancreatic duct and the jejunum to facilitate drainage is called as pancreaticojejunostomy. Jejunostomy tube placement. Usually in the operative report we will see it as a J tube. So insertion of feeding tube directly into the jejunum for nutritional support is called as jejunostomy tube placement. Next we will see few procedures related to large intestine, or otherwise we will call it as colon procedure. So colonoscopy. Endoscopic examination of the entire colon to detect abnormalities or perform interventions is called as colonoscopy. So this colonoscopy is exclusively for large intestine. Okay, so here your starting point is anus, ending point is ileocecal valve. Sigmoidoscopy. So endoscopic examination of sigmoid colon and rectum is called as sigmoidoscopy. So all these procedures are mostly for identify the tissues or diseases in the large intestine. Colostomy. Creation of an opening from the colon to the abdominal surface for waste elimination is called as colostomy. Okay. Ileostomy. Creation of opening from the small intestine to the abdominal surface for waste elimination. Okay. So colostomy means creation of opening from the colon to the abdominal surface. Ileostomy means small intestinal to the abdominal surface. Colectomy. So surgical removal of all or part of the colon often due to disease called as colectomy. Most of the time physician will perform colectomy for colon cancer. Colpoproctostomy. Surgical connection between colon and rectum to restore bowel continuity is called as coloproctostomy. Next, diverticulectomy. Okay, removal of diverticulum from the gastrointestinal tract is called as diverticulectomy. This diverticulectomy is exclusively related to GI procedure. So what is a diverticulum? So diverticulum is a small pouch. Snare polypectomy. Removal of polyps using a wire loop during endoscopy is called as snare polypectomy. Hard biopsy. So hard biopsy is the one of the technique in order to remove the polyps during the colonoscopy. So hard biopsy. So previously we have discussed correct endoscopic mucosal resection. So this is the procedure. Removal of superficial layers of the gastrointestinal lining during endoscopy. Okay. Next, fistula repair. So basically fistula is the abnormal connection between two parts of the gastrointestinal tract. Okay. Fistulectomy. Surgical removal of fistula is called as fistulectomy. Fissurectomy. Surgical removal of anal fissure to promote healing called as fissurectomy. Colonic stent placement. So insertion of a stent to keep narrowed section of the colon open is called as stent. So in the reports wherever you see colon like stent insertion, most of the time the stent purpose is to open the narrowed section of any type of anatomical area. Okay. Next we have procedures related to anus and rectum. Okay, so anoscopy, examination of the anal canal using small scope is called as anoscopy. So proctoscopy, here procto means examination of the rectum and anal canal using a scope. Hemorrhoidectomy, so surgical removal of hemorrhoids. Hemorrhoid band ligation, so basically hemorrhoid band ligation and hemorrhoidectomy are both the treatment for removal of the hemorrhoids. Technique is different. Hemorrhoidectomy, physician will remove the hemorrhoids. In the hemorrhoid band ligation, physician will place the rubber bands around the hemorrhoids. Okay. Next, hemorrhoid column refers to the individual vascular structures that can become enlarged and form hemorrhoids. Is called as hemorrhoid column. In the coding, you will see it as right hemorrhoid or posterior hemorrhoid, lateral hemorrhoid, like that. So wherever you see directions like anterior, posterior, lateral, you need to understand that these are the codes for internal hemorrhoids. Next, rectopexy, surgical fixation of the rectum to correct rectal prolapse. So your diagnosis will be rectal prolapse. So rectal prolapse repair, rectoplexy, surgical correction of the rectum protruding through the anus is called as rectal prolapse. Okay. Next, we have procedures related to appendix and abdominal cavity. So most common procedure in the appendix is appendectomy, surgical removal of the appendix. Okay. Next we have Meckel's diverticulectomy. So removing a Meckel's diverticulum if inflamed or bleeding is called as Meckel's diverticulectomy. So what is diverticulum here? It is a like pouch. Okay. So abscess drainage, GI abscess drainage, draining pus from abdominal or perirectal abscess is called as GI drainage or abscess drainage. Paracentesis. So needle drainage of fluid from the abdomen. Usually physician will perform this paracentesis procedure for ascites. Okay. So adhesiolysis. Cutting abdominal scar tissue causing pain or blockage. So if the patient performs cutting of abdominal scar, we will call it as adhesiolysis. Most of the time we will not code adhesive along with other procedure. If the patient performs only adhesive, we will code this adhesive CPT code or ICD-10 PCS code. So if you have any difficulty understanding these definitions, please mention in the comment section. Okay. Next, bowel obstruction release. So usually we'll call it as enterolysis. So releasing trapped bowel due to obstruction is called as bowel obstruction release, or other time enterolysis. Okay. Intersubstance reduction, treating bowel telescoping either by enema or surgery, is called as intersubstance reduction. Next, we will see procedure related to pancreas and biliary. Okay, so previously we have discussed correct ERCP. So this is the endoscopic retrograde cholangiopancreatography, which combines endoscopy and X-ray to examine the bile duct and pancreatic ducts. Stone extraction, removing stone from bile or pancreatic ducts during ERCP is called as ERCP with stone extraction. Transmural drainage of pseudocyst. So creating a pathway between the stomach and a pancreatic pseudocyst for drainage. So pancreatectomy. So this is the simple removal of all or part of the pancreas is called as pancreatectomy. Biliary stent placement. So inserting a stent in bile duct to keep it open. So as we have discussed previously, wherever you see the stent insertion, most of the time patient will perform this procedure for narrowing or stenosis, or if the patient wants to open the hollow structure. Next we will see liver and gallbladder procedures. So these are very important procedures we will see in the medical coding. So cholecystectomy, surgical removal of gallbladder is called as cholecystectomy. Liver biopsy, taking a small piece of liver tissue for testing is called as biopsy. So basically wherever you see biopsy, we need to understand it is related to taking the a small piece of sample for testing. So liver transplantation, replacing a diseased liver with a donor liver. So backbench work of transplantation. So preparing the donor organ before it is implanted is called as backbench work of transplantation. Next, cadaver donor. So if the patient takes organ from a deceased person, we will call it as cadaver donor. Next, HIDA, hepatobiliary immunodiacetic acid scan, imaging test to check bile flow from the liver and gallbladder. Liver elastography, usually we will call it as fibroscan, non-invasive test to measure liver stiffness. Next, we will see procedures related to feeding tube and drainage procedures. So PEG tube placement. So what is PEG tube? Percutaneous enteroscopy gastrostomy tube. So inserting a tube into the stomach for feeding through the abdominal wall is called as PEG tube. So naso or orogastric tube placement. Temporary tube inserted via nose or mouth to the stomach for feeding or suction is called as naso or orogastric tube placement. Okay. So percutaneous gastrostomy tube placement. So same as PEG, long-term feeding access directly to the stomach. So far we have learned all the procedures related to diagnostic as well as therapeutic procedures. Now we have few diagnostic and functional tests. Okay. So GA biopsy, tissue sample can be taken during a scope procedure for testing. Fecal occult blood test, detect hidden blood in stool. Stool DNA test, checks for colon cancer, marks in stool. Breathe test for H. pylori, so detects bacteria causing ulcers. Anorectal manometry, here also pressure measurements. So previously we have discussed correct sphincter. So measures pressure and strength of the anal sphincter using the anorectal manometry. So okay guys, these are the most common procedures you will encounter while coding J procedure, whether it is in outpatient using CPT or inpatient using ICD-10 PCS. So if you like this session, please click on like button and motivate me to provide more valuable videos like this. And also if anyone looking for medical coding jobs in UAE, USA and India, please join in our WhatsApp group. Group link is in the description of this video. And also if anyone looking for surgery coding training, please send WhatsApp message to 707-526-3939.